It can happen in a variety of ways, on the job, playing sports, or just normal everyday activities, and about 75% of the population suffers from them. Injuries, which in time can lead to chronic pain and arthritis, and regardless of how they occur, they can interfere with all aspects of a person's life.
We see a lot of different types of injuries, and we see the acute injuries when people come in just from getting hurt, and we see the injuries that are coming in from chronic problems in the past. A lot of these ones that are chronic pain, there's something that's happened a long time ago, whether it's a week, a month, a few years ago. They were in a car accident, they had a trauma to the back, and something that's led to the instability of the back to the knee, which has over time caused degeneration of that joint.
A doctor can generally assess your injury and grade it based on the severity. From there, treatment can vary, and it's not always successful.
In the past, we used to treat these types of injuries or pain with more cover-up type treatments like a cortisone shot or chronic pain medication, which is not addressing the problem. The problem that we're really dealing with chronic pain is the degeneration, the wear and tear, the instability of a joint. So what we're finding now is there's new treatments out there that change the way you think about an injury. Let's not just cover it up, let's do something to help regenerate and repair the problem.
These new treatment modalities that have proven to be successful in the treatment of ligament, tendon, and joint arthritis are making waves in the field of regenerative medicine. Prolotherapy and platelet-rich plasma therapy, or PRP, are both forms of regenerative injections.
PRP and prolotherapy are both what I'd call regenerative type treatments. It's a new modality that we use to get the body itself to go in and repair where it's breaking down and aging or injured. So prolotherapy itself stands for prolo or proliferation, which leads to new growth of tissue where the body is broken down.
Dr. Joel Baumgartner is a board-certified physician with specialized fellowship training in non-surgical orthopedics and sports medicine. He uses the latest in diagnostic and treatment technology to treat a variety of injuries and pain at his practice in St. Cloud, located just 45 miles west of Minneapolis-St. Paul.
Our goal with these regenerative treatments is to get the body to repair itself through stimulation of either their blood products or through other means of stimulation. If they have chronic diseases that are uncontrolled, if they're smoking, if their immune system's down, if there's hormones that are imbalanced, or if they're fatigued chronically, their body just won't be able to repair itself. So the goal is to get the body healed on the inside first and deal with a lot of those chronic disease states and issues, get that taken care of, then when we go back to do the injections, the body will actually respond and we'll get a much better healing response.
Prolotherapy targets the joints, ligaments, and tendons that are weakened and stretched out from injury or aging and actually promotes healing and repair. This stimulation of the body's healing mechanism helps to restore strength and integrity to the damaged area.
In 1973, I had an accident in a ditch cave-in which caused me severe pain morning, noon, and night, 24/7 on my lower back, almost devastating my life. I received prolotherapy from Dr. Baumgartner, and I now have a new lease on life, virtually, completely pain-free.
When I first started doing these types of procedures, I had read the literature and I saw the science, and it made sense that it would work to repair these types of processes. But it wasn't really until you see those patients come back 6 months later and they're dancing again and they're playing with their grandkids and they ran a 5K that you realize, hey, this stuff really does work. It's not just the science that proves it works, it's actually the testimonies of the patients that really speak volumes.
Blood is made from approximately 93% red blood cells, 1% white blood cells, 6% platelets, and plasma. When platelets are activated in the body, they release healing proteins called growth factors. The cumulative result is accelerated tissue and wound healing.
Now we're able to treat these injuries with less downtime through a regenerative process as opposed to in the past where we just cover these injuries up or tell them there's nothing more I can do to help you.
I was in a car accident in 1994, a rollover where I ended up dangling from the seatbelt for some time, and that's caused a lot of chronic neck pain and migraines, and I've tried just about every therapy that's out there and really haven't had drastic improvement of symptoms. Since I was referred to Dr. Baumgartner for the PRP therapy, it's been great. I've had longer times without headaches and they haven't been as intense, and I'm just really optimistic.
Though Dr. Baumgartner's specialty is sports medicine and injury and pain treatment from a medical and orthopedic perspective, he doesn't just focus on the injury or the area of pain, but he looks to the other processes of the body that may be amplifying the pain or slowing down the healing process.
When we're treating chronic pain and degeneration, wear and tear of the body, we found that if the body itself isn't tuned up, for example, their diabetes status, if they're still smoking, if they're way overweight, the body's only going to give us a partial healing when we try to repair it. So if we can get those factors under control, get them hormonally balanced, get their nutrition optimized, they're going to have a much better healing response with our procedures.
Using regenerative procedures, Dr. Baumgartner and his staff focus on non-surgical treatments to enhance, repair, and heal the body. At Rejuv Medical, the goal is to treat the problem and heal what is broken, rather than simply cover it up. To learn more about Rejuv Medical or to make an appointment, call today or visit rejuvmedical.com.